Good afternoon, everybody, and you are most welcome to the seventh webinar in our series, Complexity Theory for Better Child Protection and Welfare and Public Services. My name is John Canavan. I'm a professor of political science and sociology at the university here, and I'm the UNESCO Chair in Children, Youth and Civic Engagement. And with colleagues today, Dr. Aisling Gillen and Professor Carolyn McGregor, we are going to do the webinar for you. So just to say a brief word about the webinar, I suppose it's always been our intention with this series to take complexity theory as a set of ideas and to see, can we make it practically relevant, useful for people in the real world of practice and policy. So today's webinar is particularly focused on drawing together learning from the webinar series and also some of the academic outputs we've created and have the opportunity to reflect on its possibilities. The focus is today primarily child protection and welfare. However, we would regard this as relevant and significant also for other sectors of public policy. So just to give you a little bit of kind of a structure, we will do the webinar in three parts. The first, really, I'm just going to do a quick reminder on some key ideas from systems thinking and complexity systems thinking. Aisling is then going to bring us forward and really present in a kind of an integrated way some of the key ideas from the colleagues that have presented over the series. And then Caroline, on behalf of herself and Dr. Carmel Devaney, who can't be with us in a presenting way today, will talk about, I suppose, the possibility of making this work in practice and giving some clear ideas around that. From a housekeeping point of view, we're hoping to do this in around 45 minutes, so hopefully we can stick to time, but also to give time to you to ask questions and to put some comments in. And we're asking to do this via the Q&A function on Zoom. So that's really where we're at, and I'm going to kick off now and talk a little bit about, I suppose, where this is coming from and what are some of the key ideas. So the first question, I suppose, in a sense is, well, why were we doing this anyway, and why in Galway, and why in the UNESCO Child and Family Research Centre and in the discipline of applied social sciences? I suppose we had two reasons. One, we had done significant work for TUSLA looking at systems change. And within that work, I suppose, we were really saying, well, that's good and helpful, but there's probably more to it. So it was kind of an experience of doing research and thinking about systems change that actually pointed us towards maybe the complex nature of that systems change. And then I suppose there's a practical reason. We had the pleasure and honor of having Aisling Gillen, Dr. Aisling Gillen, with us in a research policy fellow or policy research fellow role for a number of years, and somebody who was interested in and could drive forward this area. And really, we can say that the birth and the framing of this work comes from Aisling, and just to say thank you to her for that work. But to move on and to think about, well, why does this matter, if you want, in the sense of child protection, we can refer to Caffrey's insights, who talks about, well, there's a number of reasons, but you could kind of take four good ones as to why complexity matters in child protection and welfare. First is that child protection and welfare is a wicked problem. There is a kind of an inherent kind of contestation of the problem itself and the solutions. There might be differences between families and professionals and so on. And also this, I suppose, sense in which there are very kind of intractable and difficult situations which we all know about and deal with it. And certainly the idea of uncertainty is always there. I suppose the other point, which is maybe a little bit more kind of theoretical and so on in terms of the term, but for all of these terms, we think that they actually have very concrete meaning, which is the extent to which systems might be set up in particular sorts of ways, and there might be clear roles and responsibilities. But like all human systems, they actually do their own thing to a degree, and they form and self-organized, and particularly when there's kind of more an enabling legislative and policy context rather than one that's constraining. So it's always going on, it's always self-organizing. I suppose the third thing to say is that child protection systems have to be open systems because they depend on a variety of professionals for them to work and for them to be meaningful. And therefore, what we bring into these open systems, I suppose, is a variety of different perspectives, um, different ways of thinking, different information, and so on. And I suppose then finally, we can think about the degree to which small changes can have unpredictable effects. So, in other words, things might be going along nicely if you want in an individual and specific child protection case, but one small change, whether that's to do with, for example, the arrival of a partner into a system who maybe is supportive. Let's look at it positively, who actually was in a situation of saying that this person could be a suitable person to support the retention of a child at home or whatever in the context of something that was going maybe the wrong way. Okay, so that's kind of just setting the scene from a child protection perspective. But to go back a little bit and think about systems thinking generally, the image, I suppose, is really to show you that we're talking about a lens, we're talking about a way of looking at things. And when you look at things, they kind of look different depending on what lens you look at them through. So when we talk about systems thinking, we're talking about systems and what are they? So what I'm going to do here is I'm going to talk about the idea of maybe a local child protection team. Okay. So if you want to see that team as a system, so within that team, there are these, set of elements, people, physical office space, computers, and so on, and different types of professionals and so on. And obviously then the children, parents, and other professionals that enter into that. But that relates to boundaries. So the boundaries in any system, they separate and distinguish the system from other systems and the environment. And those boundaries can be thick or thin. Those boundaries can let people in, can be engaging, can keep people out. And we know, for example, in terms of, we've got there now, but maybe 20 years ago, this idea of information sharing and the challenges of that is an indication about permeability of boundaries. But systems are obviously about goals. So local child protection systems are trying to make sure that children are safe and their development is protected in that locality they work in. But within that, I suppose there are different levels, and there might be, again, the very small level of a small goal that would be achieved within a family system. But again, that leads to the higher level goal of, if you want, the safety of the child and so on. Critically, I suppose systems operate within feedback loops. There is always feedback into systems to tell us, are we doing well or wrong, or well or poorly, and what we need to change. And again, that's always the case. And people who work in the front line of child protection will know all about feedback from a variety of sources. Again, subsystems matter. There might be within the child protection team locally, there might be a subsystem, which is the administrative system, and that has to work effectively for the overall system to work. So that's kind of just a little bit. I mean, the last point, I suppose, is just to highlight that an effective system, a system that's going to work and function well, is going to be a system that has variety and has resources in it. Because in the context of change and in the context of things that come at systems, having that variety will mean that it's more able to respond and adapt, which is a word I'll pick up on in a second. So we move from systems thinking to complex and complexity theory, I suppose, complex systems, because in a sense, and we're going to look at the word nonlinear in a minute, but I suppose when we say a system is complex, it cannot be fully described through the components, the interaction between the components because of their nonlinear nature. Okay, so that's really, really, really important. And then I suppose when we think about complexity theory as an area of work, really what we're trying to study is the dynamics of interactions and interrelationships and how this relates to innovation and change, okay? And we are all in organizations. So that's a nice definition for the future for somebody who might want to look at that. One thing we can say about complexity, it isn't always about the large number of elements in it. Sometimes there might be a small number of elements, but the interactions between them might be significantly and seriously complex. Okay, so that's the complex and kind of moving from systems to complex systems thinking. Okay, probably giving you a lot to take in, but broadly speaking, keeping in mind this is a way of looking at things, number one, and all of these ideas have direct and concrete applicability to real life practice contexts. So then just moving on and talking about some of the ideas, the core ideas, okay? We talk about linearity and non-linearity. So I suppose in a sense, the image on the left with the balls that bang off each other, you can say what's going to happen. There's a kind of a cause and effect. If this, then that. And we know from experience that most child protection systems, there might be and experiences and cases, there might be a degree to which that's the case for sure, but it's never quite like that. And sometimes it's a little bit like the image on the right hand side, which is you start with an idea, a blueprint or plan, and actually it becomes far more complex in practice. The example I give is when you've got a logic model for an intervention in the social sphere, and actually when it comes to implement it, it becomes in reality far more complex, far more involving far more interactions, feedback loops, and so on. So that's just, I suppose, a kind of a way of thinking about linearity and non-linearity. So in this context, we can say, particularly because of the cross-sectoral nature of work, we can say that causality is going to be more likely unstable and non-linear and context specific. So again, always coming back to this challenge of making decisions in the context of uncertainty. The image here is about, I suppose, the idea of emergence and self-organization and adaptation. So if you look, an image of a river or a stream. Now you can see in any stream, it's going to have a kind of a regular enough pattern of water flow and so on. But what's actually there is going to differ all of the time. And that's just to kind of reflect the idea of emergence. So just to give a concrete example from the history of child protection and welfare in Ireland, I would say safely that the idea of family support and the field of family support really just emerged. There was an enablement in legislation in 1991 for sure, but in reality, what happened was people began to say, well, we're doing family support in all sorts of different areas, whether that was in community development and child protection and so on, mental health. So there's something about what happens when our systems just emerge, they organize, they just kind of create their own meaning. The related aspect of this is how systems will adapt to change. There's a kind of a need, if you want, for systems to self-organize, to kind of organize themselves into ways that make sense in that context. But there's also, I suppose, the extent to which the organization is often in response to external pressures, new things that happen. So, in other words, let's say if we have a new children's first guidelines or something like that, the system will begin to change and look slightly different in terms of what's demanded. So, that's the idea of emergence and self organization, and a kind of its cousin or its brother, maybe, or sister, the idea of adaptation. So, what we've got now is we've got linearity, non linearity, and we've got emergence, self organization, and adaptation. And I suppose the final thing I want to talk about is that the twin concepts, if you want, of path dependency and bifurcation. And these have purchase, these have meaning, these have applicability all the way from the top of policy down to the front line of meeting the needs of children and achieving their rights. Because if we think about path dependency, what we're talking about is the extent to which things we are doing something and we are stuck on that. We are locked in, if you want to use that kind of language. And that's what the image on the left is talking about. So I could say that in terms of path dependency, in spite of the 1991 Child Care Act, there was a path dependency there in terms of the voices of children, which only began to be challenged in the context of the investigations in the 90s, the Kelly Fitzgeralds, et cetera, et cetera. These and the West of Ireland farmer case. So these cases began to actually break that up. And that leads on to the bifurcation piece, which is it's a complicated word, but it's not really. It's about that move from a situation of, turmoil because the current path we're on isn't working, to choice, to going different directions. And again, that's the idea here of moving and facing choices about transitions, big jumps or change, tipping points, and so on. And in that regard, you might say, and I think it's a valid one to make. I think a tipping point in terms of Irish policy for children in Ireland was probably the National Children's Strategy in terms of its enumeration of a focus on well-being and rights of children and prioritising, and a lot that followed from there. So our work, I suppose, has kind of, built over the last while. through these webinars. We produced a book, Aisling, myself, Carmel, and Caroline, and you'll see this image throughout the rest of the webinar, which is really thinking about what we think you might be a way to move forward in thinking about child protection and welfare and the application of complexity theory to that. So that's me. So I'm going to hand over to Aisling now. And what Aisling is going to talk about, I suppose, is, well, when we go reflect on the webinar series, well, what were the esteemed colleagues talking about, and what are the ideas that they brought forward? So handing over to Aisling now.
Thanks, John. So I'm going to provide just some reflections and learnings from the 6 webinars from our webinar series, Complexity Theory for Better Child Protection and Welfare in Public Services. The webinars are openly available on the University of Galway website, and thanks to Gillian, who's curated them there, we would really encourage you to look at them, because they are actually very reflective in this zone around complexity theory and its application to public services. So just to give you an idea of the keynote speakers we had on the webinar series, we had Professor Rick Hood from Kingston University, Professor Rhodes from Trinity College Dublin, Professor Eileen Munro, London School of Economics, Samia McHale, Western Sydney University, Professor Muriel Bian, Neely School of Business, Texas, and Mariana Colvin, Associate Professor, the Sanders School of Social Work in Florida. And we had a range of respondents from senior academics in TUSLA, HSE, academia, leaders, practitioners, right across a range of different people responding. So do take a bit of time if you have it, and have a look at the webinar series. All of our speakers and respondents had in common that their focus was on complexity theory and really trying to think through its practical application to child protection and welfare and public services. So in the next slide, John has talked about linearity and non-linearity, but Eileen Munro posed the question, is change management a linear process? And I know that for those of us who've worked in child protection and welfare, we'd be damn glad if we started at A and worked through to Z in a predictable manner. But usually it's more like our next slide, which is in complex practice, services and systems. John, to move on, it's more like where many variables and factors affect and influence emergent outcomes. And it looks more like this. It's very messy. So really trying to understand what is happening in complexity is our key consideration here. So if we take a look at the systems complexity framework that John had up there a few minutes ago from our book Systems Complexity Theory, to make sense of the complexity in child protection and welfare, we believe that there are 3 key emergent considerations, and I'm going to frame the learnings under those 3 key considerations because they all came up and were reflected through all of the webinars. And the first of those is acknowledging complexity. The second is framing complexity, just finding ways of describing both the systemic and dynamic characteristics of complexity. And the third is focusing on connecting in complexity. So firstly, our speakers talked about acknowledging that child protection and welfare practice, services and systems are complex. John talked about this. Wicked problems, child protection and welfare are considered to be wicked problems. As it's difficult to define when an endpoint is reached, problems may seem at times unsolvable, and we've all been in that situation. They have unique configurations, so solutions that work in one situation may not be applicable in others. Unanticipated outcomes keep arising, so things do not travel directly from a line from A to Z. Professor Hood referred specifically, and John mentioned it, volatility and drift, managing uncertainty, the start again syndrome. And Rick Hood raised the question, can procedures tame messy realities? And we'll come back to that in a minute. Practice, services and systems in complexity tend to be characterized, as John has talked about there, non-linearity, self-organization, basically that if we think about family support, very much an emergent ground up phenomenon in terms of people self-organizing in response to need, path dependency, emergence, adaptation. And John talked about positive and negative feedback loops and their impact into family, child, and system situations. Child protection decision making is burdensome. We think about the scope and scale of decisions, the gravity of decisions, the emotional toll on workers, and fear in workers of not making the right decision. Sammy McHale talks about the complexity of the inter-organizational and intra-organizational landscape. And she has really reflected on instabilities can include different professional perspectives, issues of trust, turnover, morale, retention, that idea of lack of continuity, logistics and unpredictability, competition, even between voluntary, private, statutory organizations, competitions between professionals, communications issues, organizational bureaucracy, information sharing issues, political and policy shifts can influence the direction of travel, defensive practice, and a blame culture, the difficulties of mobilizing a shared vision. And I'll come back to that as well. So in the next slide, what we're really looking at is, how do we think about acknowledging complexity? How do we go about that? And Sammy McHale has talked about complexity absorption rather than complexity reduction. And this really, I suppose, made sense to me because it's actually being fit to sit with the complexity, to mull it over, to try to make sense of it, to bring others in to try to make sense of it together. Because our tendency is very often at times to compartmentalize and simplify in complexity, but we need to sit with the overarching complexity to try and make sense of it together. Professor Mary Ulbian talks about adaptive versus ordered focused responses. She talks about sitting comfortably, more comfortably in that space between order and chaos, and trying to kind of sit in that space and make sense of what is happening. Rick Hood and Eileen Munro talk about gearing systems around the changing needs of citizens. And again, they're talking about sitting in that adaptive space, that you can't just set out a system and expect it'll work cleanly from A to Z, but it's sitting in that adaptive space, gearing systems around the changing needs of citizens. Professor Mary Rhodes from Trinity talks about framing complexity, finding ways of describing it that make sense, those concepts that John is talking about, self-organization, adaptation, bifurcation, path dependency, ways of describing the complexity of what is going on. And Marianne Colvin talks about the importance of connecting in complexity through focusing on agents and networks and on enhanced participatory practices. So how can we acknowledge complexity if we don't work with people to acknowledge the complexity in their lives, to work with the complexity in systems, and to try to make sense of it together? So the next consideration from our speakers was how to frame complexity to help us to understand what is happening in human services. And Professor Mary Rhodes, through an analysis of 12 community projects situated in the north and south of Ireland, emphasised focusing on understanding both the systemic and dynamic characteristics of complexity. Next slide. In considering practice services and systems, Mary Rhodes talks about understanding what is the system. I'll move on to the next slide. What is the nature of the internal and external environment, taking into account political, technological, physical, and reputational factors? What are the framing, policy, and legislative environmental rules and standards that a system adheres to? Who are the people involved? What are their specific roles, functions, and historical connections? What are the business processes that apply, and what are the intended versus emergent outcomes? So that's fine. I think it's really important to know the system and understand what is happening systemically. But additionally, And this is where kind of the focus on kind of the dynamics of complexity. Systems are not, as John said, static. You know, there's a huge amount of people involved. They're constantly shifting, constantly moving. So it's really important to understand dynamically what is happening in systems. And consideration has to be given to the dynamic characteristics. So how are agents in the system self-organizing and adapting to emergent issues and concerns? What are agents' past histories and historical starting points and influences? What influences all of us at any point in time? What baggage are we bringing forward into other situations? What are the tipping points, the bifurcation points that John talks about that occur, that create or inhibit change, that either act as kind of stabilizing influences or that pivot into changing situations? How can we support adaptability in practice, services, and systems? So what is the learning from the webinars in terms of how we go about framing and understanding complexity? So as well as understanding the system and what's influencing practice, services, and systems, all of our speakers talked about needing to engage in collective sense making to understand histories and their impact on the present. All of our speakers talked about discussing and interrogating key tipping points to understand fully what is happening in discontinuity. So what is happening when things go wrong? Bringing as much variety and information sharing as possible to decision making and sense making at that point in time. Professor Rick Hood advises us to beware default approaches, as we cannot split up a child. So, you know, talking about, oh, it's a mental health problem, it's an educational issue, but actually losing sight of the whole child. Mary Rhodes again talks about the need for collective decision making and adaptive leadership practices. Professors Eileen Munro and Rick Hood talk about focusing on understanding what helps and hinders, designing in the fundamentals of practice, the importance of service standards, but really interrogating what makes them work. So one example I was thinking of was that in the west of Ireland, at one point in time, we took together a cross-section of staff from a lot of different areas together to look at foster care standards. So we were really interested in I'm a firm believer that we absolutely need standards, but more importantly, we need to understand what makes them work and how can we best get good quality work out of those standards, and how do we make sense together to figure out what's working, what isn't working, and how can we share that information. So designing in the fundamentals of practice, but really interrogating service standards as to what will make them work. Working with the emergent situation. So working with that discontinuity, timing and action, context and situation, values, but also gut. Things are not working here. You know, why are they not working? Who needs to connect? How do we make sense together? Sammy McHale talks about the need to integrate diverse perspectives, the empowering of children's voices, which the UNESCO Child and Family Research Centre is critically focused on, the work of Danielle Keenan and others, supporting holistic approaches and enhancing decision-making quality. Mary Ulbian advocates for adopting an enabling leadership approach that encourages adaptability and self-organization. So really, to frame complexity, we really need to sit with it, make sense of it, find ways of articulating what it is and trying to make sense of it and understand it together. The Chief Operations Officer for the West, Tony Canavan, talked about developing a common vision and giving permissions to progress. And I suppose it's that idea of framing the complexity. And in his case, what he talked about is framing the complexity of hospitals' need to integrate better with community. And he talked about practical examples of where that vision being laid out led to self-organization by staff and working with the community sector, leading to innovations in across hospital community sectoral work around diabetes and cardiac care. So that idea of articulating a common vision, articulate the complexity of the issue and in a common way so we can self-organize and work forward from it. The third consideration is connecting in complexity. And here we can consider, all of our speakers talked about mechanisms for connecting in complexity. And I think it's worth just putting them forward here. So at the practice level, talked about group supervision, participatory practices, inter and intra-professional information sharing and problem solving, professional supervisory practices. My colleague, Professor Carolyn McGregor, very strongly about service at the service level. Mariana Colvin very strongly talks about the value of formal and informal intra and interagency methods and their importance in terms of working with complexity. Our own respondents from TUSLA talked about child families of children, young people services, conferencing, family welfare conferencing as mechanisms to bring people together, to make sense together in complexity. And at the system level, what was talked about with shared learning, my personal strong focus on agency, university partnerships, critical to success in this complex area of child protection, welfare, public service work, the need for kind of strong learning work together, the idea of collaborative strategic foresight analysis work, collectively working together, using data to analyze what is effectively and using that data to try and predict what the emergent outcomes might be and how we need to work together to make sense together what is happening in complexity. So again, what are the learnings from the webinars in relation to connecting in complexity? And really what our speakers talked about in the next slide was identify and engage with and facilitate information exchange with key agents and stakeholders and sponsors for change and understand information flows. John talked about, identifying, understanding boundaries, permeability, that organizations have boundaries with other organizations, families have boundaries with other members of the family and the public and the community. Identifying how fitness to respond lie. Does it lie internally in the family? Does it lie externally? Does it lie internally in an organization? Does it lie externally? And really trying to work through how do we need to connect together to work through the complexity of situations arising. The importance of participatory approaches, Sammy McHale straight into it very strongly about that. Mobilizing formal and informal, as I said, cross-sectoral networks, partnerships, strategic alliances to share knowledge, resources, etc. Focus on collective sense-making and adaptability, that hopefully working together. Mary Olbian talks about a different form of leadership and contrasts top-down leadership with an adaptive self-organizing leadership style, and they're actually training leaders in her academic sphere around being adaptive leaderships, adaptive leaders, not always looking for a top-down solution to a problem, but working, self-organizing, working forward with a common vision, as Tony Canavan has talked about. Consider attractors and performance peaks. So really important to understand, as John said, one small thing can put something off course. So really, Eileen Munro was very strong about understanding what is supporting system change or family change and what is affecting it adversely, and understanding that and making sense of that and connecting around that to support growth and development. Adopting real-time monitoring of outcomes and adaptive behaviours. That's being present with what is happening and making sense of things as they are occurring and being on top of the issues at any point in time. And I think the last point here is supporting cross-cutting learning. So overarchingly, our proposition is, as John said, we've put forward a set of ideas that complexity theory may be an aid to decision-making in the complex area of child protection and welfare, work and public services. I think it's useful to hold those three key concepts in our systems complexity framework, which are acknowledging complexity, absorbing complexity, not fearing it, framing complexity, finding ways to think about it and describe it, and connecting in complexity, working collaboratively with as much variety as possible to make sense together about what is happening in discontinuity and in continuity in complex practice, services and systems. As I've said, we'd encourage you to view the webinars and hear directly from our international and national experts and respondents. So there's a wealth of information there. So I'm going to pass you over now to Caroline, who's going to consider how the complexity lens might inform practice. So thank you for listening.
Thanks very much, Aisling and John. And I'm now going to just talk a little bit about how we might apply that to practice. And just starting with the next slide, to say I'm here on behalf of my colleague Carmel Devani and I. And just as we see in the next slide, John, what I want to talk about is how we might think through what John and Aisling have talked about in terms of particularly how that might inform practice. I'm very grateful to the opportunity to work with Carmel and John and Aisling in terms of really thinking about how a complexity lens can help to inform on the ground practice. And I think with the work of the webinars and the work we've done in the book, I think it's been really, really interesting to really apply this in a way that I think can be very useful in practice. And just with the short time we have left, I'm just going to give a few illustrations of that. So sort of suggesting that maybe there's three dimensions that we can think about when we think about practice to really try and develop that complexity lens. And that is use of a supportive protective framework, engaging with that complexity of children's and parents' rights, and really thinking about how we can use a complexity frame to improve how we think about participatory practice. And in the book that John refers to, we've sort of used a case study to apply this, but just for today, I'll just give a couple of brief examples. So in relation to protective support and supportive protection, this is a body of work that Carmel and I have been working on, and have a number of publications, I suppose, to back this up if people are interested. But broadly, the idea of a protective supportive protection framework is to try and help us to see the complexity of supporting and protecting families within that sort of broad continuum, sort of buffered by the notion that child protection is everybody's responsibility and family support is everyone's responsibility. The importance of seeing prevention that goes across the continuum of child protection, likewise support. And really just starting to think about, when we're talking about supporting, we need to be thinking about protective support, and we're talking about protecting, we're talking about supportive protection. So just moving on to the next slide, how might that complexity lens that John and Aisling have discussed helped? Well, if we think about framing, one of our key messages with the use of a protective supportive protective framework is that it helps us to think about the integration of these complex interrelationship between supporting and protecting at any point, as opposed to interfacing, which we can tend to sometimes do. We can tend to, because we need thresholds and we need to differentiate, sometimes that can lock us in, and we can sort of have a path dependency of reverting to, I suppose, a child protection focus or an individualized or linear way of thinking about either individual family history. We think this framework really helps to avoid families hovering in what we might call the ambiguous space between services. We've lots of evidence of maybe families being referred into child protection systems that don't meet the threshold, and yet at the same time, they don't necessarily get a comprehensive support service either. In work led by Carmel, the idea of families in the middle sort of came out very strongly in terms of review of the use of MEHL, for example, that most families, many families that we work with, sort of ebb and flow, that their needs shift and move between the need for support and protection. So that idea of a more holistic way of thinking about it. Just one more point about the framework on the next slide is how that might be used in relation to self-organisation. And what I mean by that is how practitioners organise themselves, teams, local areas. And I suppose the framework is really a way of possibly informing how we might have a more integrated system, but also really importantly about a frame for decision making, that when we're making decisions, to sort of have that broader complexity frame in our mind in terms of protective support and supportive protection. And I think sort of that can be particularly helpful in terms of building better cooperation between family support and child protection services, and also particularly in the context of current changes of focusing on networking within complex systems, just to get that integration between a range of different support and protection interventions that are not linear, and often people need different degrees of. But then that in itself doesn't capture all of the complexities. And moving on to the next slide, the second one, I suppose, we really encourage us to think about is engaging with how we think about children's rights and parents' rights. And again, that often there can be a little bit of a duality there in terms of sometimes thinking about them in a separate way. So we can use the term of framing or trying to move beyond path dependency to maybe challenge what we would suggest is maybe sometimes locked in thinking when we talk about parents' rights, particularly uh, in the public sphere. It can sometimes very quickly get into a debate about that tension between the role of the state in relation to intervening with families and the rights of parents to freedom and independence. You know, we can sometimes get locked in, and while we focus on children's rights, there can sometimes be a risk that we somehow wrongly put parents' rights and children's rights kind of in conflict, as opposed to seeing them as very much part of a whole system thinking about rights. And I guess this is tricky. So in terms of acknowledge and connect, it's tricky because part of the key learning of using a complexity lens is to acknowledge that this is very complex. And we would suggest that this sort of, you know, in terms of trying to get that right balance between meeting both parents and children's rights in a comprehensive way within a child protection system is actually one of the most complex features of child protection and welfare that we can't necessarily change because of the nature of that complexity, but we can think about how we respond and try to avoid that overly locked in or bifurcated way of thinking. And I suppose our suggestion is that actually one of the real tipping points we can achieve in this, in terms of, like John talked about, emergence and self-organisation, is really to try and push through on participatory practices. And I'll just talk about that for a few minutes on the next slide. So we've made a lot of advancements in terms of participatory practice with both children, young people and families. But I think there's a long way to go and a lot we can achieve by maybe putting this complexity lens onto it. So I've just taken two ways that we might think of it here. First of all, to acknowledge the complexity of participation. And what we mean by that is, you know, it's inevitable that with the nature of some child protection welfare interventions, that you're possibly going to be starting with the distance between practitioners and where parents and carers may be, especially if there's public mistrust, or especially if there's a worry or concern that it's a challenging to parenting capacity or risk of removal. So that we acknowledge that that's a natural starting point for participatory practice. And if we do that, we can then think about how we can work together collaboratively across the system to actively create a tipping point towards greater power sharing and participating with children and young people. And in the book chapter, we sort of give some kind of concrete examples about how you might actually do that with a specific case study in mind. And then in the next slide, just back to self-organisation again, what might we do? What can you do? Say if you're a practitioner listening, a team leader, thinking about the changes that are happening in terms of at local level. So I guess, you know, one of the key messages I think is to recognise the expertise of people working within the system of managing these inevitable ambiguities. So, you know, we can't take away the complexity that comes with trying to intervene for the best outcomes for children where there are, for example, child protection concerns. So that expertise of getting that balance between the participation of young people, honouring the voice of parents and doing your statutory duty. And I guess also a key message is just to try, we have to have business processes, we have to have guides and thresholds and so on, but not to let them lock us in terms of making our decision making overly instrumental. The other thing that's very interesting to note, referring back to what John was explaining about systems, in terms of sometimes it doesn't have to be a huge change. Sometimes it can be a small ripple change in a system that can have an impact. And just to recognize that moments of decision making, each individual case decision making, is an opportunity to create a tipping point towards more participation, more power sharing, starting with acknowledging the complexity, but actually having clear pathways about how you're going to work together through that. So just a couple of final points then to wrap up. Having said all that, it comes back again, even if there is kind of the most insightful and complexity aware, say, practitioner or team, it still requires that system to be open to that kind of complexity aware practice. So the work, that potential is strongly influenced by organizational culture and the capacity for the worker to work within that. But just sort of kind of 4 final kind of our messages. The first, I suppose, is challenging linear thinking and action. So whatever we're doing to try and look at it from that sort of broad protective support, supportive protection framework, recognise the need to mediate children's and parents' rights in a participatory way. And it's already been mentioned, I think, by both John and Aisling, to take time. You know, part of this is actually taking time to review and analyse decision making and to look at path dependencies, to look at how often we continue to follow the same path, even though we know from the evidence that that probably isn't the best path, to take time to do that. So just 2 final messages then before I hand back to John, just in the next slide. Like the reality of working in relation to supporting and protecting families, particularly those who come to the attention of child protection and welfare systems, is that we can rarely predict the life course they're going to follow. And we probably haven't had a lot of control or sometimes we don't, in the life course that has led them to where they are. But we can, I think, predict that how we self-organize and how we engage does have an impact. And also that impact is probably most likely to lead to more reliable and valid and authentic pathways to positive outcomes. And just kind of referring back to finish, I find this diagram really helpful myself to kind of remind myself just of the key guidance that I can take for practice in terms of acknowledging the complexity, framing it like I've suggested with the protective support, supportive protection, and that sort of making the connections between that kind of system, processes and dynamic, which is the practitioner, the self-organization and the engagement. So I'm going to hand back to John now, who's going to wrap up the seminar.
Thanks very much, Caroline. So again, I don't know, have we got some questions or any thoughts from our participants at the moment? We can give it a minute if people want to just ask a question or have a comment. It's the comfort with silence, I suppose, is something that we have to probably get good at. So, I mean, again, just from our own perspective, I suppose the key point in all of this exercise is that it's genuinely a concern that what we're talking about here is not for the ivory tower only, that it is not, you know, that comfortable abstract carry on that you might, you know, sometimes think that academics are involved in. And I mean, our work towards this has been genuinely towards maybe seeing, is it meaningful? Is it helpful to somebody who's in practice? And I suppose maybe I might ask that question specifically, and even if there's a couple of comments on that, I'd be interested to hear what people have to say. So please, maybe we'll give that a minute to see what people have to say about, is this of use to you?
So John, just while we're waiting for people maybe to come in with some questions, one of the things I didn't mention, but Aisling mentioned, is as a tool in supervision. You know, the value maybe of being able to use some of those concepts that we've talked about as a way for talking through a case in detail, or for kind of detailed case discussions in peer supervision. That was something I meant to say, that, and again, the protective sport protective framework, Carmel and I we wrote a paper just separately, just on how to use it for supervision for safety, and it could connect well with what yourself and Aisling have covered around the complexity theory as well. That's maybe one idea.
Yeah. Okay, well, I mean, I can assume then that people have found it useful. You're here, and we hope that that today kind of serves as a decent wrap up of the series. I mean, our intention from here is to keep going with some of these ideas and see if we can develop them further in connection with people in policy and practice into the future. So at this point, oh well, I see a few Q&As have come in. There we go. So it's definitely of use. It's becoming more talked about in practice, but I would see the collaboration between our practitioners and organizations becoming more encouraged. I would probably like to see the practitioner, the lack of communication and knowledge about what similar practitioners offer can sometimes be a barrier to families. Well, there we go. I mean, that's the connecting and complexity idea that we have talked about, and Aisling has talked about. It's that key point. And maybe I suppose just the idea of practitioners in the front line and the organizations, maybe there's something about enablement that comes from organizations, the leadership that allows emergence to happen, and so on. This and the whole series have been so insightful and provoking. Thank you all. So, and I will bring it back. But that's really lovely to hear. That's from Mary Butler Walsh. I should have said the first comment was from Maeve Lennan. There's an anonymous attendee. It might be helpful to have a template people can use to help reflect. Well, on that, that's really a good question, and it's something that we're happy to possibly think about providing. Within the book, there's a lot of detail on this. So if you've got access to a library and an electronic version, what we have is a set of kind of guiding questions and ideas, really quite detailed on all of these different areas. So that might be something that you might pick up on. So again,
John, I might come in on that one,
yeah,
if that's
sure,
okay.
yeah.
I think it's well, first of all, thanks everyone for the comments and questions. One of the suggestions that we also make, and that Carmel and I have kind of really emphasized, is I think a template is a great idea, but ideally it'd be lovely to see practitioners getting involved in maybe testing this out in practice, and getting involved in some kind of practice research or partnerships around working this out, because there's only so far, much and all as we really want to kind of inform practice, it will be even more constructive to have practitioners get involved in testing this out and trying it, and really interested to hear from people who might want to do that. Sorry, John, back to you.
That's great. Thank you, Caroline. And also just for Caroline Jordan, just highlighting it's important for reflective practice individually and for a strategic approach to policy and practice. I mean, within the book, we really talk about that a good bit, which is to challenge policymakers to, to do that step back almost, to really think about, well, where we've come from to here, and is it possible to go a different direction, and so on, and just the possibilities of doing things differently and being open to that. And the collective sense making that Aisling talks about, I think, is a really significant piece, I think, within the complexity frame. So yeah, so thank you for those questions, and I hope that gives us some bit of a feedback on it. So look, as we approach 2 o'clock, just really it comes back to me to first of all, to say thank you for coming today and participating, and for those of you who were part of the overall experience over the last number of, maybe it's about 2 years, Aisling, I suppose we're doing this, is it? So I appreciate your involvement. Just to say thanks to the colleagues who have helped with this work, our panelists over the years, our academic panelists we've referred to, and obviously critically our practice and policy panelists that have helped us. Just a quick thank you to Gillian Brown, who has run this and curated this work and has also looked after it on our website, so it is available, and hopefully people will act on Aisling's suggestion, which is to use the material. And just to say kind of a final word of thanks to Dr. Aisling Gillen. Aisling has made an outstanding contribution to the development of this area, obviously in the Irish context, but through her leadership on the book we've produced, has made a significant contribution into international thinking on child protection and welfare. And just to say thanks, and thanks for her work with us in the centre over the last number of years. So we'll just say goodbye, and thank you all for your participation today. Goodbye now.